Hi, I'm going to read you out the formal response from the Minister for Health to the Queensland petition for mistreatment, neglect and abuse occurring in healthcare facilities. Then I am going to reread you some of the key points from the petition, and you can decide if the Minister's response is appropriate. I write in response to the petition number 3449-26 tabled in Parliament on the 10th of February 2026 in relation to the Mental Health Act 2016, now known as the Act. I acknowledge the concerns raised in the petition regarding mental health settings, including the use of restrictive practices. Mental health legislation in Queensland is consistent with nationally and internationally accepted standards for providing treatment and care. The Act has a strong focus on least restrictive practices and ensuring patients' rights are protected, and treatment and care must be provided in a way that safeguards the rights of the persons receiving treatment, is least restrictive of the rights and liberties of the person, and promotes the recovery of the person and their ability to live in the community without the need for involuntary treatment and care. In addition to the legislative framework, care provided by Queensland Health Mental Health Services is delivered in accordance with contemporary clinical practice and standards, including the National Safety and Quality Health Service standards. These standards were developed to ensure that mental health services in hospitals and community deliver high-quality care that is reflective of nationally agreed person-centred approaches, protocols and requirements. In line with the standards and the Act, less restrictive approaches for providing treatment and care must be considered before restrictive practices can be used, as these are the last resort option for the protection of the person and the safety of others. I note that the petition mentions availability of legal representation for people who are appearing before the Mental Health Review Tribunal. I can advise that the Act contains provisions for the appointment of legal representatives at no cost to the person for a range of hearing types, with 2,992 appointments made in the last financial year. These appointments are in addition to the rights provided in the Act for all patients to have legal representation in tribunal hearings. Thank you for raising this important matter with me, and I trust this information is of assistance to the petitioners. Yours sincerely, Tim Nichols, MP, Minister for Health and Ambulance Services, Member for Clayfield. Now I'm going to read you the issues identified in the petition which the Minister is responding to. These are the issues. 1. Disregard for the severe harms of involuntary treatment and detention. 2. Use of coercive control and threats by staff. 3. Falsification of medical records by staff. 4. Physical and sexual abuse of patients by staff. 5. Denial of rape kits. 6. Denial of medical care based on psychiatric labels. 7. Denying patient access to medical records during and post-admission. 8. Changing of health records without patient consent. I've lost track of my numbers. 9. Blocking transfers to voluntary care. 10. Unauthorised sharing of private patient data. 11. Non-compliance with Ryan's Rule. 12. Systemic racism, sexism, ableism, homophobia and transphobia. 13. Retaliation against whistleblowing staff. 14. Complaints of serious misconduct containing physical evidence rejected or closed with rulings of no wrongdoing. Now I'm going to read you what we requested in the petition from the Minister for Health. We requested a ban on involuntary psychiatric and medical treatment, a ban on restrictive practices and forced procedures, an investigation into the forced medical procedures of eating disorder patients. We requested that they ensure state-funded legal representation to all detained individuals, inclusive of at mental health review tribunals. We requested that they fully comply with the optional protocol to the Convention Against Torture and International Human Rights Law, which Australia is a signatory to but have failed to comply with. We also requested that they fund and implement anti-carceral care models designed and led by survivors. We requested that they ensure formal public responses and apologies from the current and former Ministers for Health and Disability, the Public Guardian, Queensland Eating Disorder Service, the Office of the Health Ombudsman, for the harms caused. And we also requested strong legal protections for whistleblowers. Now, I would like you to let me know if you feel that the Minister's response fully captures what was within the petition to begin with. Thanks.